Hey guys, this is Somitro and you are watching my YouTube channel Medico Somitro. So today I'm gonna say or discuss about the terminologies in mental health. Okay, so just stay with me. Okay, this video gonna be uh, in two parts. Okay, so we'll discuss one by one. Okay, first we'll see every action. What is the meaning of every action? So it's a kind of treatment procedure where the painful experiences are voluntarily recalled to awareness. So it's a kind of treatment procedure whereas the physiotherapist or physiotherapist, not physiotherapist, like the therapist, counselor, guider, they will use the painful experiences to treat the patient. Understand? Then we'll see the addiction. What is the meaning of the addiction? So it's a strong dependence, both physical and emotional, on alcohol or some other material. So addiction is a term where we can see the patients are mostly substance abused patients. The individual, those are dependent to substances abuse like alcohol or any other smoking, cocaine, uh, amphetamine, different sort of substances. Those are strongly dependent. They are addicted. They are recognized as addicted people. Then we'll see agitation. What is the meaning of agitation? Agitations mean presence of anxiety with severe motor restlessness. So it's a kind of restlessness movement, presence of anxiety. So individual will feel anxiety. Because of that severe anxiety, we can see severe motor restlessness. Then we'll see agnosia, loss of comprehensions of auditory, visuals or other sensations, although the loss of comprehensions of auditory, visuals or other sensations, although the sensory sphere is intact. So here the individual, we can see the individual will lose auditory, visuals or other sensations through the sensory sphere, although the sensory sphere is intact. Although all the sensory sphere is intact like normal, but the individual can be seen the losing of auditory, visuals or other sensations. Then we'll see the agoraphobia. Agoraphobia means fear of being in a place from which escape might be difficult or embarrassing. So agoraphobia means it's a fear of being in a place. Like one individual cannot stay in a specific place for a long time, although he doesn't want to be there. Okay, so this is the agoraphobia. Then we'll say the akathisia. Akathisia means motor restlessness, inability to sit still. So it's a kind of disorder where the individual cannot sit simply in a one place. Okay, this is the akathisia. Then we'll see anhedonia. Anhedonia means inability to experience pleasure in any activity. So the individual mainly we can see this kind of features in autism, where the child or the most of the time childs. So autism, the child will not experience any sort of pleasure in any activity. Either it could be like any game or any other activities, any games, any playing activities. So the children doesn't feel any pleasure in any activity. That is the anhedonia. Then we'll see the remaining terminologies. Ambivalence. What is the meaning of ambivalence? The coexistence of two opposite drives, desires, feelings, emotions towards same person, same objects or goal. So here we can see that coexistence of two opposite at a time drives, desires, feelings, emotions towards the same person. Like one individual will feel at a time jealous or be happy with the same person. That is the kind of emotions, or that is the kind of feelings of an individual in these conditions, ambivalence, right? Then we can see the next terminology, anorexia nervosa. What is the meaning of the anorexia? Anorexia means the not taking food properly, or like loss of appetite, right? So anorexia nervosa is a kind of eating disorder where we can see the because of the body shaming or like concern, they are so concerned to body weight. Because of that only they will stop taking food. This is the anorexia nervosa. Then we'll see the apathy. Apathy in the sense, in the sense lack of emotional feeling. So apathy is a kind of conditions where the individual will be lacking with emotional feeling. Understand? Then the next terminology is aphasia. Aphasia, absence or impairment of the ability to communicate through speech, writing, or signs due to the dysfunctions of brain centers. So aphasia is a kind of conditions where the absence or impairment of the ability to communicate through speech, writing, or signs due to the dysfunctions of brain centers. So because of the dysfunctioning of the brain center, we can see the individual impairment of ability to communicate through the writing or the signs. Okay, they cannot communicate through the writing or any sort of speech. This is the aphasia. It is different from apathy, whereas the apathy is lack of emotional feeling, right? Then we'll see the autistic thinking. Autistic thinking means preoccupations totally removing a person from reality. So it's a kind of thinking disorders where the individual removing like preoccupied thought, it is there inside the brain previously, that is differ from the reality. Okay, so it is a kind of thinking disorder or like thought disorders where the individual preoccupied thought is differ from the reality. Understand? Then we can see the evolutions is lack of motivations. So if the individual is out of the motivations or like lacking of the motivations, then we are calling it is a evolutions. Then we'll see the biofeedback. It's a kind of method of teaching patients to recognize tensions with the body and to respond with relaxation. So it's a kind of method of teaching patients to recognize tensions with the body and to respond with the relaxations. So you might have seen in different sort of movies where the in charge officer, they will check either the criminal, like suspected criminal, is telling lie or true by this biofeedback. Understand? Then we can see the bulimia nervosa. Bulimia nervosa completely differ from anorexia nervosa, where we can see in anorexia nervosa the individual stopping their food intaking, but in bulimia nervosa they will consume more food, but they will do, they will vomit soon after the eating of the food. Next we will see the cataplexy. What is the meaning of the cataplexy? Cataplexy is the temporary loss of muscles tone and weakness precipitated by a variety of emotional states. So it's a kind of loss of muscle tone which is temporary and weakness of the precipitated by a variety of emotional state. Because of the certain emotional state, individual will temporary loss their muscle tone and weakness. And next we'll see the catharsis. Catharsis means the expressions of ideas, thoughts, and suppressed material accompanied by an appropriate emotional response that products a state of relief in the patient. So catharsis means the expression of ideas, thoughts, suppressed material accompanied by an appropriate emotional response. So it's a kind of expressions of the ideas or thoughts or suppressed material accompanied by an appropriate emotional response that products a state of relief in a patient. Understood? Then we can see the circumstantiality. It's a kind of disorder of an individual or like mentally ill patients, where the individual started some conversations, but before they coming to the point, they will move around the point, but they will come later at the point. Like, see, what is saying in this point is a pattern of communications that is demonstrated by the speakers inclusion of many irrelevant and unnecessary details. So they will started telling the irrelevant and unnecessary details in his speech before he is able to come to the point. Okay, so before he is coming to the point, he will say the unnecessary and like detailed thing in his speech. Then we'll say the clank association. It's a kind of clinical features in many patients, many patients, right? So client uses two words with a similar sound, that is, his choice of word is determined by the sound and not by their meaning. Okay. Then we'll say the confabulation. Confabulations means so the unconscious feeling of memory gaps by in like imagined or untrue experiences due to the memory impairment. So confabulations is the consciousness unconscious feeling of memory gaps. So unconsciously the memory gaps will be filled by imagined or untrue experiences due to memory impairment. Because of the it's a kind of disorder where the individual will forget some memory in their mind, in their brain, but they will fulfill that gap with the imagined or untrue experiences. Understood? Then we'll see the conversions. I already discussed in ego defense mechanism, right? Conversion. What is the meaning of conversion? Conversions in the sense where the individual will like psychological conflict will convert into the physical symptoms. For an example, the individual or the student who doesn't want to go to a doesn't want to attempt a exam because of the psychological conflicts, next morning he can appear with the symptoms, physical symptoms of fever. Understood? This is the conversion. Then crisis in a simple word it could be say it's a psychological disequilibrium in a person who confronts hazards circumference that constitute an important problem which for the time he or she neither escape nor solve with usual problem solving resources. So it's a psychological disequilibrium in a person who confronts a hazard circumference that constitute an important problem which for the time he or she neither escape nor solve with usual problem solving resources. Is it clear? Okay, so the next video will be soon. This is the part 1, and so if you really like this video, just like it and don't forget to press the bell icon also. Subscribe the channel, please support, and if you like the video, please share it with your friends. Up to that, stay happy, stay healthy. Thank you.